Hi, I'm Dr. Kate Kresge, naturopathic doctor and director at Fullscript. I'm here to demonstrate how you can use Fullscript to simplify your lab workflow and focus more of your time on patient care. This is your lab orders dashboard. This is where you can manage and track all of your lab orders and see the status of every order, whether it's not yet purchased, shipped, being processed, or if results are pending, partial, or complete. If you want to focus on something specific, like results that are ready, you can click into a tab and review them in seconds. We'll be taking a closer look at some of this later in the video. The Labs catalog is where you can access blood and specialty tests across all major health categories all in one place. You can search by test name, lab company, biomarker, test type, or health category. If you frequently order certain tests, you can hover over the star icon next to a test and click Add to Favorites. Now, these will appear at the top of a test list when you search, and it will let you filter by clicking Only Show Favorites. You can also filter by lab company to see what's available in your account, or narrow your search by health category, sample type, or test category, depending on what you're looking for. Now, let's walk through how to build and send a lab plan. I'm going to walk you through how to send a lab order as the account owner. Providers and staff members added to your account can also send lab plans. I'll show you how to set up providers and staff to manage labs at the end of this video. Start by selecting a patient. In this case, I'll select Susan Booker. If your patient has uploaded previous lab results, you can review them here, which can be helpful for deciding what to retest or where to focus. Later in this demo, I'll show you how Fullscript auto-generates result interpretations that take into account these previously uploaded labs. Here, I can see Susan's past results to decide next steps. Let's take a look at her CBC. Here, you can see that her results are summarized, and Fullscript can display optimal, suboptimal, abnormal values right from this view. If we click into MCV, which is elevated, you can see that we flagged this and shown that this may suggest that she's got something like macadamia. If we go back to her other labs, we can see that she also has a history of some low serum B12. Her CMP shows slightly elevated fasting glucose, but otherwise normal. Based on this and her intake, I'm going to recommend some additional tests. With Fullscript, you can build a single care plan that includes both supplements and lab testing. For Susan, we'll start by ordering a specialty test and a custom blood test panel. First, I'm going to add a SIBO 3-hour test from Genova Diagnostics directly from the lab's catalog. Next, let's build a custom blood panel. Custom blood panels help you save time by grouping together commonly ordered tests. And they can also be saved as templates to share across your practice with other providers and staff. To create one, click Build Panel or Template, then select Custom Panel. From here, you can search for individual tests and biomarkers to include in the panel. For Susan, I'm adding a celiac disease test. And I can add other markers like a CBC, CMP, and a vitamin B12 to retest to compare against her previous results. Once the panel is complete, simply add a panel name. Then click Create Custom Panel. Before adding it to the plan, you can review the included tested biomarkers, a biomarker summary, and estimated pricing. When everything looks good, click Add to Plan to include it in Susan's care plan. Now, we're ready to review Susan's plan before sending it. Here, you can write a message to add context to the plan so Susan understands why we're ordering the following tests. In the lab section, we can review lab tests we've added to Susan's plan, including a cost breakdown. We can also add a custom fee to account for interpretation time. You can edit your custom fees, including the service and rate, at any time. You can also add educational resources, additional labs, or supplements that you'd like to include, all in one plan. In the plan summary section, you can see a total cost of the plan. And when you're ready, you can choose your billing option. It's up to you how you want to handle lab billing on Fullscript. The majority of providers choose to take billing off their plate and have Fullscript handle this directly with their patients. This can be done simply by clicking Send to Patient when you're ready to send your plan. If you prefer to handle billing entirely, or if you currently bundle testing into the cost of a membership or a program, simply pay upfront for testing by checking the box for Practitioner Pay. Your patient will still receive their test instructions, but won't see test pricing, so you can handle billing with them separately. If needed, you can assign a signing provider to authorize lab orders for your practice. This is especially helpful if some providers on your team don't have full ordering access. They can still recommend labs while a designated signing provider reviews and approves the order. Before setting this up, make sure your signing provider has been invited to your Fullscript account. We'll walk through the process of adding staff to manage labs in your Fullscript account later in this video. Once you've reviewed the details of your plan to ensure everything looks correct, you can click Send to Patient. And your patient will receive an email or push notification if they have the Fullscript mobile app that a new plan is now available. Once you send a plan, you'll see a confirmation in the patient profile that they've received it. You can copy a link to the plan, copy notes, or download it if you need to attach it somewhere else in your workflow. Fullscript also offers EHR and health platform integrations, which seamlessly sync orders and results, so you don't have to duplicate work. Now, let's take a look at the experience for your patients. Fullscript makes it easy for patients to review, purchase, and complete their lab testing, all in one place. When a plan is ready, patients receive a notification in the Home tab of their account. Here, Susan can review her provider's message, the SIBO specialty test, and the custom Quest panel before placing her order. Susan can add the SIBO test to her cart and complete checkout directly in Fullscript. Once purchased, the specialty kit is prepared and shipped from a Fullscript distribution center. For the Quest panel, Susan enters her own zip code to view available blood draw options and pricing. Based on her location, she can visit a local Quest patient service center or schedule a mobile phlebotomy draw through GetLabs for added convenience. Both scheduling options can happen directly within Fullscript without needing to leave the platform. Before checkout, Susan can review all order details in her cart. Once the purchase is complete, Fullscript guides her through next steps for sample collection. The SIBO kit ships directly to Susan and includes everything needed to complete the test. Step-by-step collection instructions, dietary and medication guidance, prepaid return packaging, you name it. Once the sample is collected, Susan simply mails it back to the lab for processing. For the Quest panel, Susan receives a digital requisition with the preparation instructions, including any fasting requirements. On the day of the appointment, she can either print the requisition or show it directly from her phone at check-in. In the provider experience, you can track every step in the lab orders dashboard, including when a patient schedules their blood draw, completes testing, or returns their specialty kit. Now, let's take a look at Susan's results back in the provider experience. In the lab's orders dashboard, we can now see that Susan's results are ready for review. Let's start with Susan's blood lab results. Clicking the order will bring you to the test details page, where you can choose to either download the original lab report or click View Results to access Fullscript's interpretation layer. Every interpretation is designed with functional biomarker ranges, developed and maintained by Fullscript's medical advisory team, drawing from peer-reviewed and trusted medical sources like PubMed, Science Direct, the CDC, Cleveland Clinic, and the Merck Manual. At the top of your interpretation, you'll see a bar graph showing the standard reference range and the functional range based on green for optimal values, orange for suboptimal, and red to highlight any areas that are out of range. You can easily focus on areas to address in Susan's results. For example, you can see here that Susan's B12 results are low. Because Susan has uploaded previous lab results, we can also see that even though her B12 is low, it is slightly higher than the last time she had her labs drawn. I love that this view has helped me to eliminate the need to put my clients' values in spreadsheets or manually track them over time. You'll notice a drafted interpretation for the markers that are out of range, powered by advanced AI models. You can review, edit, and save drafts as you see fit. You can also flag these markers, bringing them to the top of the report for both yourself and your patient. I would also proceed to review the other out-of-range markers in Susan's results, including the slightly elevated glucose levels in the CMP and her positive celiac panel. Based on Susan's results, I would probably recommend something like a gluten-free diet and a referral to a gastroenterologist. In the meantime, I might have her consider a glutamine-rich supplement, maybe with something like GlutaShield to help repair her gut lining. And I'd consider a highly absorbable liquid or powdered multivitamin. When you're ready, you could send these results to your patient. They'll receive the same report, complete with the visuals and context that help them understand the results. Now, let's take a look at Susan's specialty results. For specialty labs, you'll get results via a PDF, just like you're used to when ordering directly from the lab. You can notice here that it looks like Susan's got a little bit of SIBO going on, so we're going to help her with that. If you need support interpreting lab results, you can schedule a clinical consult directly with the lab if ordering under your own license. Fullscript provides contact information and guidance on reaching out to our lab partners for interpretation support. When you're ready, you can send the result to Susan. She'll be notified via email that results are available to her in her Fullscript account. You can also send a note with it. Once you're set up with labs, you can bring your team in to help manage the day-to-day. Remember that you must complete lab registration since staff can't register on your behalf. Staff members can support nearly every part of the lab's workflow, so you don't have to do it all yourself. Once registered, staff can do things like add lab tests to patient plans, create and manage custom panels, track testing status, view and share results, access the lab orders dashboard, and more. You can also assign a staff member to receive a lab result notification on your behalf, ensuring results go to the right point of contact to follow up with patients. To add a staff member, click Invite Staff and fill out their details, including things like name, email, role, and practitioner type. You can also set permissions for staff based on the level of access that you'd like them to have in your Fullscript account. And that's it. I hope you found this walkthrough helpful as you start to implement labs on Fullscript into your practice. With Fullscript, you can manage your entire labs workflow from ordering to results in a single place, so you can spend less time managing labs and more time acting on insights for your patients.